Hi, it's Dr. Jim again. Today we're talking about arthritis, what causes it, and how you treat it. If that sounds good to you, stay tuned. First, let's talk about osteoarthritis. Osteoarthritis, I like to think of it as wear and tear arthritis. Usually occurs in advanced age. It affects the dominant side of the body. So if you're right-handed, it affects the right side, your right hip, your right hand, and your knee. There's usually or often a family history for osteoarthritis. And again, it affects just one side, usually the hands, the knees, and the hips. Medications that we use to treat osteoarthritis are Tylenol, ibuprofen, and naproxen, and sometimes when it's early on, physical therapy will be beneficial. Unfortunately, if it advances, you may be looking at knee replacement or hip replacement. That's what osteoarthritis does and what it's all about over time. The image shown here is typical for osteoarthritis, actually quite advanced osteoarthritis. Notice how the joints are knobby. Notice how they look somewhat swollen. They look stiff, but they're not red and puffy. When osteoarthritis starts, patients experience just a little bit of discomfort in the joints, and then the joints become stiff, and then they start to develop the knobby appearance that you see here. This is an X-ray of osteoarthritis showing how the joints of the finger look like they're destroyed. You can kind of see spicules on it. They look like they're deformed, and they don't appear like they work very well. On the other hand, the joints where the fingers meet the hand, those joints look pretty good. They look like they're functional. And indeed, in osteoarthritis, especially of the hands, it's the joints at the end of the fingers that are involved. And that's where the pain starts, and that's where the stiffness starts, and that's where the destruction first occurs. So now let's talk about inflammatory arthritis. I'm talking about rheumatoid arthritis and psoriatic arthritis. With both of these conditions, they can occur in multiple joints throughout the body. The difference between rheumatoid arthritis and psoriatic arthritis is that in psoriatic arthritis, patients not only have inflamed, tender, and painful joints, they also have a condition known as psoriasis, a condition, again, that's about the immune system, gone kind of upside down and crazy. But in addition to the joint stuff, they've also got tenderness or inflammation and irritation and destruction of the skin. And the skin generally is involved in the elbows and the knees, but it can be the back, it can be the abdomen, around the neck, it can be all over the body. And it's very unpleasant for people that are especially severely affected. But both of these are about the immune system. The immune system attacking the skin, attacking the joints, causing joint inflammation, joint pain, and untreated joint destruction. Psoriatic arthritis and rheumatoid arthritis are treated with very special medications. You've seen them on TV: Humira, Sclera, Skyrizi, Taltz, Rinvoq, and the like. Here's an image of rheumatoid arthritis. This is advanced. This is rheumatoid arthritis that has gone untreated. Notice how the joints are swollen, how they're red and they're disfigured, and how it occurs on both sides. These fingers are floppy. These fingers do not function. This patient probably cannot hold a glass of water and certainly can't prepare meals or work outside the home. Here's an X-ray of the same patient with rheumatoid arthritis, showing the disfiguration, the twisting and turning of the fingers over the hand, the destruction of the joints, especially where the fingers meet the hand, and how there's loss of joint space. These joints do not function, and there is no strength in these hands. Here's an image of psoriasis. Not so much the joints of psoriasis that we're talking about, but what psoriasis looks like, the scaly, flaking, irritated red skin that's associated with psoriasis. But again, in this instance, we're talking about psoriasis plus arthritis and the pain, joint destruction that goes with it. All this is pretty sobering, I must admit. Osteoarthritis, rheumatoid arthritis, psoriatic arthritis are painful. The skin conditions related with psoriasis are embarrassing and uncomfortable. Here's the good news. They're all eminently treatable. You don't have to end up with joint destruction. You don't have to live with unpleasant appearing skin because we can treat them. And we treat them with medications, treat it with physical therapy. As I mentioned in osteoarthritis, sometimes surgery is involved. But here's the take-home message. Pain means joint destruction. Get together with your doctor. Find out which medications are right for you and which will treat your disease and make this so it's not a permanent, disfiguring, and disabling life condition. This is Dr. Jim for Be Healthy, Be Happy. Give us a like, subscribe to our channel, and don't forget, power your path to happiness.